Greetings and welcome. Welcome to What is Psychotherapeutic Reiki, sponsored by Shakti Training Education Institute of Holistic Wellness. Thank you for being here today for this webinar and welcome you and your energy. Let me introduce myself. My name is Asha Sims. I am a licensed clinical mental health counselor supervisor. I'm an integrative holistic therapist. What is that? That's all a good question. And I am not one that really like to put titles, but sometimes in having a understanding of what integrated therapy is very key. I am an owner of a holistic wellness practice, a Shakti wellness and yoga, in which I serve as the clinical director. I am a clinical energy practitioner, Reiki practitioner, sensual arts educator, yogi. And I've been in the mental health field for over 25 years now, 13 years now as an energy practitioner, and which branched out into learning more about Tantra and sacred sexuality and working with my women. And 11 years as a yogi, and became a yoga instructor to assist with trauma yoga, working with women with sexual assault with violence. So this is where the role of an integrated holistic therapist came in. But before it even got to that as a professional modality, it began as a personal path. So I always have to share my experience on how do I get to this point of being an integrative holistic therapist and what does that look like? Well, it began for a personal journey of wanting to have more balance in my own self. I even became burnt out as a clinician and not feeling that the approaches I used were being effective with my clients. I kind of felt decompartmentalized with my approach because many of my clients weren't just coming with mental health issues, they were coming with physical health issues, and we're working on depression, and then the medication was causing a weight gain, then we're dealing with weight issues, and the mindset was causing the food addictions. It just seemed like there was a cycle, and it's like, where do I start? And when I wasn't feeling impactful, I began, or even sometimes we may deal with imposter syndrome, I didn't feel effective as a clinician, and I had to take a break. And during that time, it was a lot of life changes that occurred in which Reiki, I would say, found me, which started my journey in this path of being an integrative practitioner. But it started with the journey of self-healing. So all these modalities that I incorporate are modalities that I have used for myself, which allowed me to feel confident enough in integrating it into the professional practice as I am now, which has been very successful with my clients. So today we're going to talk about different things to give you some insight on awareness of what this is. So you're going to learn a little bit about the origin and history of Reiki, as well as understanding the integration of traditional psychotherapy in conjunction with Reiki and energy psychology. You're going to learn about some techniques that can be used within the clinical setting of how to apply Reiki, and also we'll discuss legal guidelines and ethical boundaries when administering Reiki in a clinical practice as well. So first, let's talk about what is Reiki. Reiki is an Eastern healing art approach with Japanese origins. Reiki comes from the Japanese word rei, which means universal life, and ki, which means energy. So we are working with universal life force energy. That is what Reiki is. So as odd as it may sound, the meaning of it is even more impactful in understanding the core of universal existence is what we're actually dealing with. So in understanding energy, before we can really go into this understanding of what psychotherapeutic Reiki is, we must understand the human energy theory, which means there are different models that we have to approach that we may have had some basic understanding in our days in school of understanding physics and laws of energy and that aspect. So now it's like, how do we apply this to the psychological? We don't do that. That's a whole different sector of understanding. But again, holistic means one. And so now we have to look at this in our energy and understand that life has, all life forms have subtle energy. Life force energy exists in everything. We all have universal life force energy. That is our universal energy field that we exist in. So all things around us that bloom, that live, has a universal energy field. Next, we have to understand too, we have our own human energy fields. Energy flows in and out of our body. Every living person has his or her own unique energy field. And that is what is very important to understand, because energy flows in and out, and we all have our own genetic blueprint based upon experiences. Now, we also have our chakras, which are energy pathways within our bodies, the chakra system. The chakras are connected to one another by a central energy channel, the meridians that flow through our bodies. So this is providing gateways of energy in so many different ways. We're not even aware of how we're connected to this universal energy field and flow that we have through our bodies. So in understanding the chakras and the subtle energy layers, let's look at this. Let's look at the different chakras. If we had to have a physical impression of what it looks, a physical, because chakras are not physical items, they're invisible energy centers. This is what the chart will look like, as well as our aura layers, our energy centers. So we see you have the base chakra right here, the root chakra, that connects with your layer one, the etheric body. This is that body of energy that is closest to your body, the densest part. You have your sacral chakra, which connects to your emotional body. The sacral chakra deals with your emotions, your right to have feelings and emotions. Your solar plexus in your stomach is your power center. This deals with your mental body. Your heart chakra, this deals with your astral body. Throat chakra, your etheric template body, your third eye, your celestial, your crown is your casual energy layer. So understand why they all connect. This is your inner outer layers of energy fields that often holds all pain, toxic thoughts and feelings, imprints from childhood, even before childhood, even from birth, is where your energy field even begins, when you're in the womb. So understanding any physical manifestations of illness in the body begins in the outer layers before it even gets to the inner core layers. So now we have here the types of Reiki, understanding there are different types and styles that people may use and have been trained under, but the underlying fact is it is a form of energy healing. So there are 5 core types of Reiki, but there are other types as well. But you had Chikidan Reiki, which is an Eastern method, Usui Reiki, which is a Western method, Karuna Reiki, Laterian Reiki, Sekimo or Kemetic Reiki are different approaches. So there are different lineages and different types and techniques, but they all deal with the whole universal energy field and the personal flow of individuals and how they process information in these energy fields. So you have the different levels of Reiki. This is very key in understanding what it takes to be attuned and be a practitioner to Reiki. And in most Reiki courses, there are different levels, different information obtained on different levels. So level 1 basically is where you work with self-healing sessions and hands-on sessions. This is where, like I said before, you start with learn how to work on yourself, how to heal you, how as the clinician or practitioner to reduce your anxiety, how you can be more grounding and present for your clients and for your own personal self. So you learn the self-healing sessions as well as your hands-on sessions and using the 12-hand positioning in level 1. Level 2, learn about the 3 symbols of Reiki, the distance symbol, which allows you to do Reiki across time and space. Energy travels wherever, just like a phone call. You can talk to someone in another part of the country and hear their voice. The same thing can occur with Reiki. So understanding that is what occurs in level 2. And then level 3 is where the self-mastery of that understanding of self to be able to teach to others. It's more advanced learning to be able to assist others. And now you will be able to teach and attune others to Reiki at this time. Then there are the benefits of Reiki. Let me explain those, because this helps you have an understanding. Why do I even want to use this in my practice at this time? What does this have to do with my practice? Well, it has a lot. Reiki is very beneficial with promoting deep relaxation, release of stress and anxiety. It can promote pain relief, ease muscle tension, peace of mind and body, increases the rate of recovery from injury, energizes and balances the whole body, as well as strengthen the immune system. So when we think of clients that we deal with and what they may encounter, we have to look at the aspect of many of the diagnoses often present itself with some of the things that the benefits of Reiki assist with. And if you see here, promotes, it's not saying it actually cures. We're not promoting that or anything. This is aiding and promoting in the relief of some of these things that we see in our clients. So how does Reiki work? Reiki is simple and a powerful healing technique that balances the energy systems of the body. This often leads to improvement in health, increased relaxation, and overall improved mental and physical well-being. So if someone's life force energy is low or blocked, they're more likely to become ill physically or mentally. So if their life force energy is high and flowing smoothly through the meridians of their body, then they're more resilient to any type of disease or illness or any type of negative energy. So they're more balanced energetically. And this has worked wonderful with my clients that have mood disorders that sometimes energetically are off. So in Reiki, the practitioner does not necessarily need to touch the body for those who have that concern, but you can do hands-on or hands-off approach with Reiki, and it does not require any special equipment or environment. Now, what is psychotherapeutic Reiki? That is very important. This is where you understand where the East meets the West in approaches. It is used to incorporate the different modalities that are used to treat psychological and emotional behavior issues like unresolved trauma, distress, anxiety, chronic pain, and combine it to allows you to help them heal by focusing on the body and the mind-body process that is occurring in the present. That's basically mindfulness. So how does Reiki integrate with mental health? All right. We see that Reiki helps the body shift from a sympathetic flight or fight anxiety mode into the parasympathetic rest and digest mode. So for those that are stuck in trauma response or that heightened sense of arousal, Reiki puts the body in a relaxed state to be able to balance out the body, which helps regulate the anxiety and the stress, which also can help regulate possible weight issues. It also helps to enhance your body's own self-healing responses and helping the body to release any type of tension or trauma and detoxifying mind, body, and spirit to help balance the mental and emotional states. It also helps you to connect with the individual subtle energy fields to clear any type of imprints on all levels, cellular, physical, all of those levels that have different imprints in. So by combining these two, you're combining the traditional talk therapy, incorporating these evidence treatment modalities that we are aware of, like mindfulness-based stress reduction, cognitive behavior therapy, acceptance and commitment therapy, to be a few that we can name that do help cope with anxiety, has shown to be evidence-based. And then combining these approaches with things like psychotherapeutic Reiki that is gaining more evidence-based statistics and research, then you can assist in a deeper level of understanding of self and others. So then from there, you can incorporate Reiki into your clinical practice. And for those who don't know if it meets medical necessity or if the interventions are therapeutic, many of you are already doing the things. It's just another added tool. Psychotherapeutic Reiki helps with the removal of blockages in psychological health and assists in releasing and clearing any type of negative effects of trauma or conditions that occur in the development of our lives. So incorporating it, you are practicing presence and mindfulness. You're exploring the body and the mind. You're releasing and clearing energy blocks. You're installing corrective experiences. You're balancing and healing, and you're using imagery and visualization to help release these psychological blockages. So the implementation of Reiki in clinical sessions can look different depending on your comfort. Anything that we do is based upon the comfort of the clinician before we can even expect our clients to be comfortable. Because remember, this is about energy. If you're feeling nervous or scared, they may feel it. Because if they're even coming to you for psychotherapeutic Reiki or want to have that approach, they're probably already energetically sensitive. And that's why they're seeking this modality. So you can use different approaches in a clinical session, excuse me, with using head and hand positions or body hand position. As you see in the pictures, you don't necessarily have to be touching the client. You can use your hands 3 to 5 inches apart from the body to assist. And again, in learning the different levels in distant healing, Reiki can be done virtually, and the client does not have to be sitting where you are in order to do it, or close proximity. So the benefits of having Reiki in therapy session, it can help to reduce emotional responses and desensitize emotional reactions. It can reduce anxiety and stress, assist in processing of trauma, grounding and stability, assist the client in processing of feelings and emotions, help clients to identify unhealthy emotions and where in the body they are holding it, stabilize mood swings, and reduce auditory and visual hallucination. This is where the technique can come in and help change and shift what is going on in that therapy session, or to help even with the processing of what has occurred and not responding in a traumatic state. The body is no longer responding in that trauma response, but is learning a way to release the trauma response when they feel it, as well as learning techniques that they can use on themselves to help reduce the feelings of anxiety. So when we look at the ethics and morals, many of you say, I have issues with the idea of touch in therapy. Again, this is based upon the comfort of the clinician before it is even introduced to the client. So we have to look at this approach of touch in therapy. And in the Western healing, there is a split in the mind and body approaches. We have more of, we deal with the mental health. We have doctors that deal with the physical body, or the physical therapist, or the massage therapist. But in reality, we have to look at as clinicians. Sometimes we have to look at what's going on with the body and learn to incorporate modalities to help that coordination of the mind and body split. So when we talk about touch, we live in a low touch environment that places little value of touch. It's confused of the boundaries of what is sexual touch and what is intimacy sometimes, because nobody touched. So it's never really developed. It's more of a taboo sometimes, or if it's used, it may be in the mindset that has to be sexual. So that's why some therapists do believe that using touch in therapy is unethical, but this is not necessarily accurate, because in anything we do, we have boundaries, we have ethics. And part of our responsibility is to create and maintain a safe environment for not only the client, but yourself. So consent should always be given, and any explanation of any potential risk, benefits, the ethical considerations, all should be stated as according to the ACA Code of Ethics, even in our initial professional disclosure statement, so clients can have this understanding. There was a research article that stated that about touch and ethically safe touch, that the ethical safe touch experience does not just happen. It must be created, structured, and sustain. So if this is a gray area, you stick with the area that you feel safe in. When it comes to Reiki and research, there is research that is being conducted daily. So this is something that is showing the effects and making this more of our approach to be used. It is considered a complementary alternative method. And it's actually already used in the hospitals. You have medical Reiki practitioners that work in hospitals. So this research is showing, there was one in 2004 that followed patients being treated for mild depression and stress, that after 6 weeks of treatment and for up to a year afterward, those who received Reiki had immediate and long-term improvements in depression, stress, and hopelessness. There was another study conducted of clients that were seen for heart surgery, and it showed that there was complete elimination of typical post-operative depression for those clients that were given Reiki during surgery. Also, research shows that the gentle touch in a safe environment does help with stress reduction and pain relief. And speaking of pain, pain often causes depression, anxiety. Reducing difficult to treat chronic pain can have a major impact on the psychological well-being of your clients. So studies have shown and found that Reiki is very effective to helping to alleviate pain, anxiety, and depression relief in our clients. So hopefully this has provided you with some information, some things to think about, whether you need to do further research, or if you would like to inquire more how to start this process. You can contact me through my email at awsims@ashaktiwellness.com. You can reach out through my social media page, Ashakti Wellness, on Facebook or on Instagram, Ashakti Wellness. Join me on my YouTube page, Ashakti Wellness, or my website at www.ashaktiwellness.com. However, that I can assist you in this journey from coaching